Hey everyone, welcome back to the Log Finance. Today we're diving into something that sounds like it belongs in an econ textbook, but is actually a real world superpower: opportunity cost. Picture this: you've got $100 to spend today. You could grab a slick new pair of shoes, or maybe take your friends out for dinner. But if you pick the shoes, no dinner. That trade off, the value of what you give up, that's opportunity cost. It's the heartbeat of economics. And trust me, it's not just about your weekend plans, it's about saving lives, building economies, and making tough calls on a global scale. To unpack this, we're going to riff off a recent piece from The Economist about shrinking foreign aid and why focusing on health, like vaccinating babies, shows opportunity cost in action. Let's get into it. So, here's the scene: it's March 27th, 2025, and the world's rich countries are tightening their belts. Foreign aid, the cash that flows to the poorest nations, is drying up. Why? Well, defense budgets are ballooning, and some folks reckon aid doesn't even work. With less money on the table, donors and recipients have to get choosy. Every dollar spent is a dollar not spent somewhere else. Build a road, and you might skip a school. Fund down tanks, and hospitals take a hit. This is where opportunity cost comes alive. It's not just what you do, but what you don't do. Economics teaches us to weigh these trade offs, because the real cost isn't just the price tag, it's the next best thing you miss out on. Now, The Economist makes a killer case. When aid's tight, pour it into public health, especially vaccines. The numbers here are wild. For every dollar spent on vaccination, you get $54 back in benefits. Yeah, $54. From 1974 to 2010, health aid stretched life expectancy across developing countries and saved millions of kids from dying before they turned 5. That's not just a win for humanity, it's an economic slam dunk. Healthier people are more productive. They work, they earn, they grow economies, plus medical breakthroughs keep piling up. Take these two new malaria vaccines: cheap, effective, ready to go, but the cash to roll them out still missing. When aid's shrinking, picking health isn't just kind, it's a bet on a bigger, brighter future. Let's zoom in on this with opportunity cost as our lens. Say a donor country's got $1 billion left for aid. They could sprinkle it across education, roads, and health, or they could laser focus on vaccinating kids against malaria, AIDS, or Ebola. What's the opportunity cost of spreading it thin? If you drop $100 million on a road instead of vaccines, you might miss out on saving thousands of lives. Lives that could have become teachers, farmers, innovators. That 54 return per vaccine dollar, roads don't touch that. Sure, infrastructure is great, but the trade-off here is brutal. Short-term wins versus long-term human and economic gold. Choosing vaccines isn't random, it's opportunity cost doing the heavy lifting, showing us the bigger payoff. And the ripple effects? Insane. Stop an Ebola outbreak early, and you save millions in treatment costs later. Costs that hit rich countries too. Back in 2014, 2 Ebola cases cost a US hospital over $1 million. Compare that to pennies for a vaccine in Africa, or think about HIV. Donor funded drugs keep patients alive and stop the virus from spreading. Bugs don't care about borders, and treatments way pricier in places like the US. So, when donors skip health aid, the opportunity cost isn't just local, it's global. More disease, higher bills, weaker economies. Learning opportunity cost helps us see this. It's not about what we spend, but what we lose if we don't. Now, let's spotlight some folks who nail this. Gavi, a global vaccine alliance, is a rock star here. They bulk buy vaccines to drive down costs, stretching every dollar. They don't just give handouts. Countries pitch in, with poorer ones getting bigger subsidies. 19 nations have graduated from Gavi's help, now paying full price themselves. That's smart, sustainable aid. Gavi also stockpiles vaccines for emergencies, Ebola, cholera, yellow fever, and they're gearing up for Mpox too. When the next pandemic hits, we'll thank them. But here's the rub, even Gavi's scrambling for cash. They need $9 billion to vaccinate 500 million kids over 5 years. Chump change next to defense budgets. But donors are dragging their feet. The opportunity cost of not funding them, millions of unprotected kids, and a world less ready for disaster. Of course, health aid isn't perfect. It can flop if it's done wrong, flood a country with cash, and local governments might slack on their own health spending, creating a crutch. Stop start funding messes up planning. Donors with clashing agendas can twist priorities, the opportunity cost of bad aid, wasted potential, and broken systems. But the smart ones have learned steady, long term support, matching local funds dollar for dollar, backing proven programs. Gavi needs that $9 billion to save lives with malaria vaccines, but uncertainty's killing them. Donors are cutting back without saying what they'll cover. That's where opportunity cost screams for clarity. Pick the winners, ditch the losers, and commit. So, why does this matter to us? Opportunity cost isn't just for policymakers, it's in your life too. Your budget, your career, your daily choices. On a global stage, it's life or death. The Economist says it best: as age shrinks, jabbing babies is a no brainer. But without understanding opportunity cost, decision makers might chase flashy distractions over real impact. Learning this isn't just academic, it's a tool to think sharper, see trade offs, and push for smarter choices. Next time you hear about a budget cut or a big policy move, ask, what's the opportunity cost? It might just flip the script. That's it for today, folks. Thanks for tuning in. If you loved this dive into economics and real world stakes, drop us a shout. Tell us what you think. Until next time, keep questioning, keep learning, and I'll catch you on the flip side.